Hello, everyone. Well, I'm here today with Dr. Jayson Oates, who is the Director of Face Body Academy in Perth and also in Subiaco. So welcome, Dr. Oates.
Hi, Trish. How are you?
Yeah, really good. Nice to have you on here again today.
Nice talking to you.
And today's a really interesting topic that we're going to talk about. We're going to talk about the, girl things and boy things. So we're going to talk about the Mona Lisa touch and the O shot. And you're going to give us a bit of a rundown. So I'll just let you start, but I don't really know much about the O shot. So give us a rundown as if I don't know anything, because this is so interesting for you listeners out there, because this is something it's groundbreaking stuff. And I think it's kind of, it's making waves in the industry for a start. And there's a solution to people's problems where they didn't know that there was a solution to a problem.
Yeah, absolutely. So the O shot, is relatively new, and it's where we're taking somebody's blood, spitting it down to get the platelets and producing PRP, the platelet-rich plasma. The platelet-rich plasma has been around for 10, 20 years or more in various areas, especially orthopedics. With the O shot, it's actually injecting that platelet-rich plasma into the clitoris itself and some of the surrounding area of the anterior vaginal wall. And it's used especially for orgasmic dysfunction, which is a surprisingly common problem that women have, where they have difficulty reaching orgasm, never having had an orgasm, or maybe not able to have orgasm with sexual intercourse, but only able to have it with, say, clitoral stimulation from a vibrator or something like that. So it's not an uncommon problem. And the O shot was developed by Dr. Charles Ronell, who's perhaps famous for the vampire facial and that picture of what's her name, Kim Kardashian?
Yeah, Kim Kardashian.
Yeah, unfortunately not one of my patients.
Yeah.
And where she's got the blood all over her face and she's had the needling, and then they've put the plasma over the top. And in fact, Dr. Ronell says that he developed the vampire facial as a way of introducing people to the whole concept of PRP and injecting it back into their body. And then once they were comfortable with that, what he was really planning on developing was this O shot, and for the men, the P shot. And so for the men, the P shot is taking that platelet-rich plasma, and of course it's your own platelets, and injecting it into the penis.
Oh, just since have I gone red?
It is the sort of thing that gives people a reason to shiver.
Yeah.
When we first started doing it, we were only using the local anaesthetic cream. A lot of people are familiar with Emla. We now use a local anaesthetic block for women when they're having it. For men, not such a big deal. Just the cream wrapped up with Glad Wrap makes all the difference and makes it numb enough. But actually, most people find it really no big deal having the injections.
Almost makes my eyes water, but I do know that I've spoken to people that have had it done, and it sounds worse than what it is.
Pretty much, it sounds worse than what it is, and certainly the problem is worse than what people sort of imagine.
Yeah.
That inability to have an orgasm, and this is a relatively new treatment. In some ways, it's one of these things where commercially it's sort of taken off without having a lot of really strong science behind it. There's lots of great anecdotes, we use the term, where people have this great result, and everybody, of course, puts it down to the benefits of the platelets. And the platelets, the reason why they're so interesting is because they're stuffed full of growth factors and healing factors. So when you have an injury and you're bleeding, the first thing that clots the blood and stops the bleeding are the platelets. So they've got the clotting factors. And then they release all of these growth factors, and they stimulate the healing for that wound. And so that's what started this whole industry of using platelet-rich plasma is to harness those growth factors and put them into an area where you want to have the body have its own healing. So that's where and why platelets have taken off so much.
All right. So just to get it right in my head, because this is what I'm hearing. Tell me if I'm right. So basically, if you suffer from not being able to have an orgasm, or by the way, is this any age? Like, is it more so for someone who's older or younger, or?
Well, that's one of these things where it hasn't really been studied. So anybody who's asking in this area. Yeah. Then it's one of the things that we offer and they can use.
Yes.
I don't know if anyone work with sexologists, and they can have a role in helping in this situation. In the US, of course, they've got their new medication. It's often described as the female Viagra. Of course, it's nothing really like Viagra at all, but it's meant to help achieve orgasm. It's not available.
What's that called? I wrote it down.
I knew you would ask. I shouldn't have mentioned it, because now I can't remember. But if you Google female Viagra, you'll find it.
I will.
It's a relatively low success rate, really, and so it's not something that I think people are really rushing into. And then perhaps some of these other more natural sort of treatments are things that we hope are going to work well. So we've been using both the O shot and the P shot for a couple of years now. And in men, it's especially for erectile function, so that they can achieve erection more easily, that it's a stronger, longer lasting erection.
And that's still the PRP process as well.
Using the PRP, yeah. What we're also combining for men with, especially erectile dysfunction, is what's called low-intensity shockwave therapy. And low-intensity shockwave therapy is nothing to do with electricity. You're not getting electric shocks. Everybody gets concerned about that, especially when it comes to their genitals. But it's a percussive device. Physiotherapists have been using it for a long time, and it's found to stimulate new blood vessels. And so the underlying problem in erectile dysfunction is closing down of the blood vessels in the penis, so they can't get that blood flow in the hard, firm erection, and have been using it on the penis. And it has now been recognised both in Europe and the US as a reasonable first-line treatment for erectile dysfunction. And I think what we'll see over the next few years becoming more and more common, and a way for men to avoid having medications like Viagra, best known medication in this area, Cialis. But recently I had a patient in his 60s, diabetic. Even the Viagra tablets weren't working for him anymore. He was needing to have injections to be able to obtain an erection. That wasn't thrilling him, and it sort of takes or dampens the mood down when you've just got to stop and have an injection. So we combined the P shot with this low-intensity shockwave therapy, and it takes about 5 or 10 minutes to do. It's painless. It's 2 sessions a week for a total of 6 sessions over 3 weeks. And he had an amazing result. And he doesn't even need to have Viagra anymore to be able to have sex. Right. And so he's a real convert. He's telling all of his friends. And it's a common problem in men, you know, even from the age of 40, but especially from the age of 50 to 60, erectile dysfunction becomes more and more common.
Yeah.
And it's a way of getting off medication. It's the body actually healing itself and stimulating this new blood flow. So it's a really interesting idea. And in fact, after I saw this particular patient, it was 6 months after his treatment and things were still going strong. I had a woman who had orgasmic dysfunction, and then it made me think, other than just having the O shot, maybe we should trial using this low-intensity shockwave therapy for women as well. So we're actually going to do a study in this, and we might work in with the local sexologist, psychologist that we work with, and just do a little trial study and see whether stimulating that increased blood flow into the clitoris has any effect in orgasmic dysfunction. And it might not. Generally, once some of the basic things such as some menopause and hormone levels, some basic trauma issues like having traumatic birth and then not be able to have orgasms after that, or pelvic surgery, hysterectomies. If there's nothing very specific that can be pointed out, then usually it's put down to a psychological problem. And in fact, that's what erectile dysfunction used to be put down to 20, 30 years ago. It was all sort of in your head, and, you're too busy, you're too stressed, and, you're just getting old, and, things just don't work as well.
Yeah.
And then it became realised that it's a vascular problem. You just need more blood flow into the penis and you'll get an erection. And I thought, well, maybe the same thinking is going on with managing female orgasmic dysfunction. I can't find any studies that have trialed using this for women. So we thought we'd, perhaps search down half a dozen women or so here in Perth and trial it. And if it doesn't work, well, then we'll write it up and publish it and say, well, at least we've tried it. It didn't work for us. Somebody else can do something different. But if it does work, then that would be fabulous. And when we do this trial, we won't combine it with the O shot, because then that just confuses things.
Okay. So the trial is for the shock wave therapy.
Yes, this low intensity shock wave. It's something that goes very fast and gently.
Yeah.
And of course we don't know. It's not been tried, but this would be a fantastic thing if it did work.
So so I can because when you explain it, so just I'll explain it in layman's terms. So basically, a woman or a man. So we'll go the lady first. So she's having problems having an orgasm. So she comes to see you, and I'll get you to talk me through the process. So basically, she comes in, you take blood, the blood gets centrifuged, and then you put local around.
Yep. So we use both the cream, plus we actually use a little injection to numb it up.
All right, and then you kind of put the blood. The PRP, I suppose, solution, for want of a better word, into the clitoris, and that kind of creates more blood flow and.
So that's the PRP of the O shot side of it. And it's not just the clitoris. In fact, it's the whole sort of anterior vaginal wall, sort of right down to the so-called G-spot sort of area, because all of that is involved in the sensory reception that leads to orgasm. And so, that's the O shot. And we use a special kind of PRP called pure PRP. It gets the highest number of platelets per mil. It uses a larger volume, so we get lots of PRP. And that's what helps make it more successful in this area. And that's sort of our traditional sort of treatment. But when we do this trial for this low intensity shockwave therapy, then we will delay doing the O shot, only use the shockwave therapy, which is the 2 sessions a week for 3 weeks. And then we don't know how quickly the results will be felt with that. It may be felt within a few weeks, but it may be even 3 months after. So we'd have to wait before doing the O shot in that case.
Okay. All right. And you're looking for women in Perth at the moment for this treatment, aren't you?
Yes, we are.
So what sort of women are you looking for? Is there a certain age, or just like if someone's had a hysterectomy, is it someone that probably you don't want to see?
Anybody who's struggling with orgasmic dysfunction. we would like, in fact, it'll probably be a requirement for the study for them to have seen their GP, discussed it, maybe had, the basic investigations and hormone investigations, looking into this. In fact, it's surprising how many women have never discussed this with their doctor and looked into it and to see whether there's something behind it.
Yeah.
So we'd like them to look into that basic sort of thing beforehand. And so long as there's nothing else specifically found, then, we'd be able to go ahead and treat.
All right. And any age?
I think any age at the moment. Well, perhaps we might have like an upper limit of 75 or something.
Okay.
But I know I'm sure there are plenty of 75-year-old women who find their orgasm just as important as when they were 25.
I hope I'm like that, yeah. when I get there.
Oh, yes, in the many decades in the future.
Yes, of course. So, all right, so I just want to run through the process again. So I'm talking about the O shot now, because do you do that with the shock therapy together normally?
Well, in men, with the P shot and the shockwave, yes, we do that together.
Okay.
Most men only have one P shot, one lot of the PRP, but it's 6 sessions of the shockwave therapy.
Yeah.
And I would imagine with women that if this trial demonstrates some benefit from the shockwave therapy, that would probably be combining the two as well.
Okay. All right. Okay. So just go back to women. So just to talk me through the process, just so anyone who wants to come, they kind of understand what the process. So we come in, draw blood, PRP, put it through the centrifuge, and then how long do you put the numbing cream and some local? So how long is the procedure basically?
Probably the whole process is about half an hour, really.
Okay.
Maybe 45 minutes. So usually, like, the first thing we do is put the numbing cream on first, then take the blood. The spinning and the preparation of the PRP is around about 20, 25 minutes, something like that.
Okay.
Then we're sort of all set up with, the stirrups and lithotomy position, and so you've got to jump up onto there. We've got a nurse practitioner who's actually very experienced with this. She went over to America and did the course with Dr. Rennells.
Mm-hmm.
And the actual injecting of the PRP, that only takes a minute or two.
Okay. And it doesn't hurt. Doesn't hurt. Well,
you've got to have a little scratch with the local, but that it's a sensitive area. And there's a few tiny little pinpricks, but now that we're using local anaesthetic, most people find it's really not a big deal.
Okay. And then, so what about afterwards? Like, can you just can you jump down the table and are you going to walk funny, or it's just like no one knows anything? Like, are you going to go back to work and people can say, "What have you had done?" You're walking funny.
Yeah, no, you shouldn't. You shouldn't be able to have any issues at all. There are all these stories on the internet of women walking out and like having orgasms in the street, and
you have them lining up.
I don't know.
Yeah. Okay.
If I believe that, certainly we've had people come back and say, yes, this definitely works. It's changed things, but not walking down the street sort of thing.
Yeah. Okay. All right. And with the P shot, you combine it with the shock therapy. Same thing. Guy comes in, take out the blood. Put the numbing cream on first, take out the blood, and then half an hour later, or whatever, just do the injections. And then can he use it straight away, or like is there a downtime?
No. So that's good. There's no downtime with this.
For ladies or men?
Ladies or men.
Okay. All right. Awesome. Oh, it's so interesting. I'm so shy to talk to you about this, but I think it's really important for people to know that it's available if you want to give it a go.
It is. It's this new and developing sort of field. I think it's opening up a lot of options for people. I think for people just to know that there is an option sort of out there is really important, and they don't have to go rushing in to do anything, but to know that, if they get to the point they need to have some other kind of therapy or treatment, that there is an option.
Yeah, something. There is something out there, and I know myself from our groups and the inquiries coming through. Like there's a buzz happening about it. There's no doubt about it. So I'm really grateful that you actually took the time today to actually talk to me about it, and I'm so happy that I could actually talk about this, because if you could see me, I'm glad it's a dark colour, because I think I'm red as a beetroot. This is like, because it's really hard to talk about, isn't it?
It is, and this is one of the things I think that we're hoping to change sort of over time, and especially with your doctor, is the ability to talk about these areas of your bodies and these issues without hiding things or being shy or ashamed. There really isn't a great reason to be limiting people's lives like that. And so we're hoping this area is going to be opening up more and more.
Yeah, that's good. Actually, I'm going to ask you one more question, because I have been asked this question, and I know the answer, and I'll probably half share the answer. But someone said to me, "How does an ear, nose, and throat specialist get involved with treating down there?" And I know that you're constantly on the lookout for into development and stuff like that. So can you give them the answer for me, please?
Yeah, it's a long story. I guess I'm naturally innovative, and I like pursuing new and interesting things. And it started because I was doing a lot of laser resurfacing, and I was using the DECA laser, which developed the Mona Lisa touch procedure, which was that first intravaginal laser that rejuvenated that menopausal, dry, itchy, irritated, unable to lubricate for sexual intercourse into a young, youthful vagina again. And when they first told me about this, I just said, no, not going to do that. I just can't see. And I said, how are we going to do it? Lasers hurt. I do it on the face all the time. I've got to numb it all up. And how are we going to numb it? And then it needs to be dry. And I just can't see this working. And of course, it did work, and it was fantastic. It's this fantastic treatment. And then I went and did a course in Europe, 5-day hands-on surgical course doing labiaplasty. And labiaplasty has become the fastest growing cosmetic surgery in the world. And these things, yes, one thing leads to another, and then once you're sort of working in this area, you meet all these women, and they're telling you what's going on and what they want sorted out, and so you keep on expanding sort of what you do, and now I'm sort of looking at developing a whole new treatment in this area that nobody else has done. I guess it's part of my nature.
Yeah, no, I'm so, it's good because it's people like that actually make create new things that happen, so it's a great thing.
Well, it'll be interesting to see, and maybe we'll be reporting back in 3 months' time or 6 months' time and say, yes, we tried it, didn't make any difference.
Yeah.
But at least we'd know.
Yeah, exactly. Well, thank you so much for your time. So I'll let you get back to your busy list of consults for today. So thank you so much for taking the time.
You're welcome, Trish. Great to talk to you.
All right. Ciao, ciao.